Hey everybody, what's going on? Happy Friday. It's Brandom Gengelbach. I'm President and CEO of the Fort Worth Chamber of Commerce. We are live from Backlot Studio here on South Main, a little bit after 12 o'clock. And we're here with the very famous Vinny Taneja, who heads up public health for Tarrant County. We're going to do some questions. We're also going to allow you to ask some questions, so use that chat feature on the left side to ask us some questions. And we're walking the walk. As you all probably have heard, and as Vinny's going to answer, it's getting pretty scary with COVID, if it wasn't already scary enough, with holidays and things. So we are wearing our mask here. We have about 12 people in the studio, have taken temperatures, doing all that, and just felt like really to set the right example, we got to be walking the walk every step of the way. So this is going to be my first interview with a mask. And I appreciate, Vinny, you being here. And so let's just jump right into it. Can you give us the latest on the numbers and data with COVID here in Tarrant County?
Absolutely. Well, first of all, thank you for having me here. And as you know, COVID has been surging in our community. Last couple of weeks have been pretty rough. Almost every day we've got more than 1,000 cases. Today we're close to 1,400 new cases. And the total count for Tarrant County is now above 89,000. That's a lot of cases, folks. In the last 2 weeks, close to 15,000 cases added.
Wow.
Yeah, it's getting rough.
Is this the height then? I know August was sort of the other height. Are we at that point now?
Yes, we have surpassed. So the week after 4th of July, really, we saw a peak of about, 6,000 cases, about 5,800. And, last couple of weeks, we've approached, 1 week was 7,500, another week was 8,500. So certainly surpassed that peak.
Yeah. So one of the things I want to address with you, it's sort of sensitive, we call it the M word, mandates. And there's been all sorts of, frankly, maybe confusion or just changes in authority of who can mandate what and what does that look like. So let's just say that my cousin Vinny is in charge. I've wanted to say that, by the way. Let's have a little fun even during a difficult time. So my cousin Vinny, you're in charge, right? And so there's no one else. You're in charge. What mandates would you like to see to sort of curb what's going on right now in Tarrant County?
Absolutely. Well, first of all, I'm just like anybody else. I don't like to be told what to do. I don't like mandates. And what I do want is people to understand that if we all work together to do the right things, mandates and restrictions can be avoided. But what we're also finding is that we are trying to do the right things, but we all say that we're doing it, but people have found ways to rationalize around it. If you go out, when the orders were put out back in March and April, people should stay home, people did that, and we saw the numbers stay pretty low. And as those orders were lifted back at the end of April, we saw, cases start to jump, and we saw the peak that happened in July. And what broke that peak was the governor's order and the county judge's executive orders about mask requirements, closing of bars, restrictions on some gatherings and things, and the numbers went low again. But as time went by, people sort of stopped doing it. Bars got reopened, restrictions on gatherings, kind of got lightened up, and now mask use has gotten light. Some people are doing it, some are not. And as you can see, we're surging again. And to complicate matters, now we're into the fall and cooler weather where we expect respiratory illnesses to start to surge anyways. So the point of all of this is if we don't all work together as a community and do those right things, and we know by now we should all wear a mask when we're out and about, except for anybody that you meet outside of your family, wear a mask, maintain a 6-foot distance, don't attend large gatherings. And what are we doing? We're doing all the opposite things. Yeah. So that's where sometimes people have to come back out and say, okay, we're going to order people to do this. Yeah. It's not that people want to order people to do this. It's that you sometimes don't have a choice. The point I'm trying to make is if we all work together, we can avoid mandates and restrictions.
Yeah, yeah. Well, it's interesting to me. So we were here preparing for this morning, and we made this conversation of, listen, we're wearing masks off on the set here, and we need to continue wearing masks regardless of this. And I found it interesting, Kurt with Capital One, who's gracious enough to sponsor this event, he was like, well, can I take my mask off? I'm just here by myself. And you said?
No, because again, we've got an indoor setting, we got 10 or 12 people here. And the example I gave is, even though we all did all the right things, we answered all the questions about screening, our temperature was taken, we signed the forms declaring that we are telling the truth and all those type of things, it's like playing Russian roulette. We know 40% of people are asymptomatic who spread COVID. So not that somebody's willingly doing this, you could be feeling just fine and have COVID. I mean, we're 12 people here. We don't know who's got COVID, who doesn't. So that risk is there. And the best way to avoid it is maintain a distance, wear a mask.
Okay, there we go. So I want to talk a little bit about numbers and data. People can make the case that you can put numbers however you want to tell the story you want. There's all sorts of theories and thoughts about how these COVID numbers are compiled and what that looks like. And let's say that I test positive for COVID, and then let's say I take another test and I test positive again. Does that double count me? Can you set the record straight on exactly what these numbers consist of and how they're calculated?
Absolutely. So no matter how many times a person is tested, if they're positive for COVID-19, they're counted only as one case. Do we count multiple tests? Yes, because that goes into other calculations about the positivity rate for that day. It goes into counting how many tests were administered. A variety of other uses for that information, but as far as counting a case goes, that person is going to be counted as one. Now, are there rare instances where we're finding people getting reinfected? Yes, there is national data showing that. So the current definition being used is that if you have had COVID confirmed with a test and you're 90 days out and you show positive again, you would be counted a second time as a case. But that's a current national standard. As more is learned about COVID and any immunity that comes with that, those will change. But currently that's a handful, a few people that we found. Overall, the person gets tested no matter how many times, they're counted as one case.
Okay, thank you. So if you have questions on the clarification, please ask those as well. I think there's a lot of people that are wondering those types of things. So here's another question I get, we all get, and that is, listen, Vinny, we're overreacting here. How many deaths a year do we have the flu versus COVID? What about heart disease and heart attacks? Why are we making such a big deal out of COVID when there's been so many other issues that we're not talking about in the U.S. as it relates to deaths?
Yeah. So folks, this is very serious. I hear this complaint a lot that, COVID has been blown out of proportion. That is not true. That is misinformation being spread. 250,000 Americans have died with COVID. Every year when the flu occurs, on average, only about 36,000 deaths occur. When the flu season is mild, those deaths are as low as 10,000 for that year. On a real bad year, we might approach 60,000, 70,000 deaths. And COVID has not been around a full year in the U.S. Our first cases occurred, in March? And we've already surpassed 250,000 deaths. So at this rate, it is 10 times more deadly than the regular seasonal flu. It has quickly become the worldwide leading cause of death. On top of all these other things, heart disease, flu, car accidents, you name it, it has shot up to the top. Over 1.3 million people have died worldwide. And just look at that math. If 1.3 million have died, we've added about 1/5. So rest of the world, 1 million. U.S. at 250,000. There's something wrong with that picture. We really need to start doing the right thing across the country and take COVID very seriously.
Yep. I want to follow up on that, and I really appreciate y'all. Vinny's been great. I'm throwing heavy questions at him. This is not some nice, pretty deal, because I know a lot of people are saying it and they're afraid to say it out loud, and there's pressure or whatever they think. So the other thing that I've heard before as well is, listen, there's some people that are very sick and they're in a really tough spot, and it could be that God forbid they're going to pass away anyway? And are we too quick to say that they're passing away from COVID as the reason? Again, I want to be very sensitive. These are sensitive subjects. I'm not making light of the situation, but people are saying, we think the deaths are higher just because these individuals are being classified in a certain way. What are your thoughts on that?
Okay, so let me ask you this. Somebody meets a car accident and they die in the hospital, but while they do all these tests, they find the person had diabetes and the person was terminal because they had cancer. What did they die of?
Yeah.
Did they die of the car accident, or did they die because they were terminal with cancer and had diabetes?
Yep.
So that's the information that's being misused. Oh, 90% of the people had so-and-so underlying health conditions, so don't count it as COVID.
Yeah.
No, they died of COVID. They were in the hospital with COVID. They died of COVID. So again, people can take the data and find ways to say, well, that's not the right way. And then if we don't share all of this information, then we're told you're not being transparent. So if the public health professionals, whether it's at the state, federal, or local level, if they're being transparent with all the information, my request is that people let us guide you through what the pandemic is. Nobody woke up, and said, well, today we're going to make a pandemic up. I mean, that's been the constant complaint I heard, oh, it's a plandemic. Well, it's not. It's a real thing. Real people are dying. And people say, oh, all these restrictions are causing economic damage. Sure they are, but it's not something that we dream up and say, today we're going to go to our job and make economic damage in the society. We're trying to make sure community stays healthy and we find a balance. Because even people that are getting ill or people that are dying, that's economic loss to our society. Just a quick example. Average length of stay, 4 to 6 days, national data showing actually 8 days. And average cost of stay in the hospital, anywhere between $40,000 to maybe $75,000, let's say $50,000. So you translate that to Tarrant County. We've already spent between $250 million to $500 million on people's health care that are in the hospital. Now you look at other people that were not in the hospital and out sick, away from work, their coworkers away from work because they were exposed, family members had to quarantine, they were away from work. So that's economic damage happening because of COVID. And then on top of that, to find a balance, you got to, sometimes, slow down what we're doing things in the economy. So yes, I mean, it's a big, big deal. And to find that balance is sort of a hard thing.
Yeah. So on that political front, I mean, again, we're keeping this real. This has definitely been used and politicized on every side imaginable. And welcome to humanity, right? Like this is just, we as humans find a way to screw up anything, me included. And so I'm curious in terms of how you feel like from that political standpoint, how have we fared in Tarrant County as it relates to the challenges of business and the challenges of the politics of the situation and the medical piece? What would you say about how it's been handled so far in Tarrant County?
I would give Tarrant County a grade A. They've done a good job. We have very strong leadership. I know right now we're all sort of facing challenge because the governor's orders are there and we got to follow them. They restrict what can or can't be done. But that's okay. As far as politicization goes, public health and politics intersects on a variety of issues. Public health doesn't always have all the policy tools that we need. So getting politics involved and getting the policy makers to understand what the information is and what needs to be done, and then letting them make the right decisions works out well. So we've had great luck working with our policymakers locally in Tarrant County. Our county commissioners, our mayors, they've done a great job, and when the time is right, they always come around and do the right thing. Right. So I trust in them that when they're given the ability to do local decisions, they will make the right decisions. And then the other thing is, people have gotten on different sides. I think this one issue about masking has gotten politicized a lot. I think we need to quit doing that. It's very serious, folks. If we can all take a 25-cent mask and wear it outside of our house when we're with other people, we can drive these numbers down and save ourselves from restrictions and economic harm. This is a very easy compromise. I'll do it any day, all day. I think you all should too.
So just to be clear then, from what you've said and what I hear, regardless of what cases what happens in Tarrant County, there's no way that there would be a shutdown based on the fact that the governor has issued this, correct? Regardless of whether the hospitals get overrun with patients or?
No, I don't think he said that. He has orders out, the governor has orders out, and the recent set of orders is GA 32. It has automatic triggers built in, and we're very close to that point. That's why we're having these conversations. So the way it described was, it's written for trauma service areas. So Tarrant County is in trauma service area E. I think the state has 22 or 27 of those regions. And so when the trauma service area surpasses 15% capacity with COVID occupied beds, then it needs to stay there for a week, and then automatically a lot of things start to trigger. Bars need to close, restaurant capacity starts to get cut, outdoor gatherings get restricted, and some other things come into play about elective surgeries and so forth. So those orders are there. Our worry is Tarrant County's already surpassed that 15% mark and has for 2 or 3 days. Do we really wait for all these auto triggers to start happening and forcing us to do things? Or as a community, are we going to come together and start acting as if these restrictions were already in play? And we can do this on our own time and on our own terms and bring the numbers down. We don't want the healthcare system to be overwhelmed, because do you really want the doctor to choose, oh, I got to have a COVID patient in the ICU, but this person's having a heart attack. Who do I put in the ICU? Yeah. We don't want that.
Yeah. So we've got about 10 minutes left. Y'all let me know if there's some questions. I can go all day. This is so important and relevant to what we're doing right now. So I want to chat a little bit about the life of someone who's in charge of public health for a community. So do you have discussions with other public health officials from around the state or around the country? I mean, I'm sure there's conferences you go to. So when you pick up the phone and call these people, you've known them for a while. I'd love to get insight into that world.
Yes, we talk on a very regular basis. Again, public health's a team sport. Nobody, had a playbook on how to, deal with a pandemic of, epic proportions. We had all read about the 1918 flu pandemic, but we weren't born, right? I mean, there was some information that we gleaned from learning from those, pandemics, and there have been smaller ones along the way. But all of us, we've practiced about different outbreaks and theorized about how to deal with a pandemic. But when the real thing hits, a lot of things are just fly by the seat of your pants, talk to your peers, what are they doing? Okay, you had this great idea, let me see if I can implement it. So yes, lots of conversations, not with other public health professionals only, but also with healthcare providers and hospital systems, elected leaders on what policy tools they have. Public health professionals sometimes don't know what power is available. So just talking to them, oh, we can do that too, okay. So a lot of those things, it's been a learning curve for all of us. And I can tell you, there's been a lot of collaboration between public health departments, healthcare systems, and our elected leaders. So this pandemic has brought us all close together as a society. And that's what I'm asking our Tarrant County folks to do again. Let's work together, drive these numbers down, because we don't want to be forced into a mandate. Yeah. And that's what we're asking. Let's just work together to drive it down.
Yeah. So you sort of already answered my next question is, with those that are on the front lines, fire and police, there's drills and there's, scenarios of awful conditions that we pray never happen. Doesn't sound like there's a whole lot of simulation you can do for a pandemic for public health that hey, all we're gonna go off site for a week and pretend that there's a horrible, vaccine or a horrible disease coming out.
Actually, we do.
Okay.
So we run simulations. It's just that when real life hits, sometimes those simulations are, okay, well, that was kind of understated. But yeah, we do run simulations all the time, and they're in different ways. Some start off as tabletop discussions. You just kind of sit around in a group, come up with a scenario and see, how you would address a situation. And the next step is more like, okay, more real world type exercise. You put on a vest, you get the location ready, You give out candy as if you're handing out pills, get people coming through so you can work out the kinks in the traffic and handling of a large-scale situation. And some are really like full-scale exercises where you have multiple entities involved. State health department would be involved, the CDC would be involved. So we've done all of those. So it does prepare us for these situations. It's not like we weren't prepared for a pandemic. It's just that when a major one hits, you always find things like, oh yeah, we didn't think of that.
Yeah.
Or the variables of how the public would react. That's hard to predict sometimes, right?
That's right.
So those are the realities, but we do plan, train, and exercise just like the fire and police do. And while we are on that topic, I got to commend our fire departments here in Tarrant County. They have been a true partner. Without them, we would be up the creek without a paddle. All these nursing home outbreaks that we've had, Fort Worth Fire in particular, and many other fire departments have been our partner. They've sent firefighters in to help do the testing of these folks. Public health did not have the staff to do all of this, and I really want to just acknowledge and thank them for their partnership.
Yeah, that's great. Well, speaking of that, so we have a couple of questions we'll try to go through real quickly before time comes up. The one I have on here is about nursing homes. So it says, we know nursing homes are a hotbed for the virus. Tell us what is being done to keep those residents safe. Are there precautions or protocols in place?
Absolutely. Well, that was on cue.
I know, that's what I mean.
Yeah. So, yes, so there are a lot of precautions in place. For a long time, nursing homes were sort of on a lockdown under the governor's orders. And recently, they've been allowed to take visitors. But in general, whenever there's a case at a nursing home, we have to activate a testing team. So public health sends that testing team. It involves public health staff, but a lot of times fire departments and their firefighters who help do the testing for us. And a lot of times we run it in our lab here locally, but if the numbers are too big and too many of them are happening, we have contracted labs that we send out testing specimens to. So we not only do nursing home residents, we also test nursing home staff. And depending on what's happening with the positivity rate in our community, there are guidelines. In certain scenarios, if the positivity rate is less than 10%, we can get by doing one testing run a week. But otherwise, it's twice a week, and we're doing that since like May. So a lot of testing has been done in our community in those nursing homes. We've found people that are positive, we've isolated them, and a lot of those outbreaks went away. Well, now we're freshly seeing a surge of nursing home outbreaks as well.
That's right. That's right. All right, we've got 2 minutes here. I'll do one was asking a stay-at-home request, which is a lockdown, and that's not happening unless these cases trigger what the governor issued. Correct?
So in the governor's orders, there's no talk about stay-at-home. What we did do was issue a public health warning looking at our local data. And part of that, it's coupled with some steps that the public needs to do, what we call the Protect Tarrant County Plan. It is not a mandate, it's a guidance document, but we are urging people to stay at home. Because when we have a lot of people come out and resume normal activities like we would when there's no pandemic, you're gonna find that a lot of cases are occurring, and that's what's happening right now. Especially when we're approaching the holidays, if we find ways to limit ourselves and go out only for essential functions, like going to work, going to school, or medical visits, grocery pickup, all those type of things, that's okay. Yeah. But otherwise, stay home as much as you can, celebrate the holiday with your immediate family that lives in your household, don't accept any visitors. Yeah. I know it sounds very harsh, but we're hoping that we make this COVID deal a one-year thing. That way we can be done with it in 2020. Vaccine is just around the corner. Therapeutics were talked about by the governor. They're already arriving. So hopefully next year we'll get back to somewhat of a normal routine, get people vaccinated, and then hopefully not have to deal with COVID.
Amen. Yeah. Amen.
Absolutely.
All right. Thanks for that. Hey, Vinny, thank you. Really, you've been an outstanding leader. We're so proud to have you in our community. Thanks for being so transparent, answering these questions. We have some more to go in our programming today. I want to thank our sponsors for this event, Kurt and Capital One up here. If you don't know, Kurt is the biggest Mavericks fan in the universe. So any questions on Capital One or on Mavericks, Kurt's your man. Let's thank our gold sponsors, Baylor Scott & White, All Saints Medical Center, Fort Worth, Medical City of Fort Worth, Thank you so much. And our silver sponsors are Bell and Texas Health Resources. So now we're going to break up into 3 sessions, and you can choose which session you'd like to attend. Here on this stage, we're going to have a program called The Role of Employee Appreciation and Mental Health. Mental health is not something we got to during our conversation, but a big issue during COVID. So Yolanda Harper with the Blue Zones Project Fort Worth is going to be right here on this main stage. And then if you look to the left side of your screen in the Sessions tab, we have a Ask the Doctors Q&A featuring local medical experts. And then we also have the new office, which is Returning to the Workplace, featuring Brad Burrows. He's a workplace strategist with Hayworth. And the most amazing Charlie Royer of Royal Commercial Interiors, who's a good friend of ours. He'll be on that as well. So we're going to have about a minute or so before we start the session. So go ahead and think about what you want to do. Thank you again, Vinny, and thank you for joining.